So we're very happy to be a part, to invite you all to this Women's Day interactive webinar session. Today, Avana Surgical Systems, in collaboration with the Chennai Menopause Society, we are here to enlighten all the participants on women's health and wellness through an interactive webinar, navigating every life stage. So just to give a very small brief, Avana is an orthopedic solution, pain relief solution organization, which provides very novel therapies to common man, to elevate common man's pain through novel therapies and products, through innovative and improvised business model to reach maximum number of patients. So today we have a very star-studded panel for this wonderful webinar on women's health and wellness. We have our expert moderator, Dr. Meera Raghavan, who will be moderating the session for us today. She is consultant urogynecologist and robotic surgeon. She is secretary of Chennai Menopause Society. Welcome, ma'am. We have Dr. T.K. Shanti Guna Singh. She is a senior consultant, obstetric and gynecologist. She is the president of Chennai Menopause Society. Ma'am, very, very honored to have you, ma'am. Dr. M.G. Dhanalakshmi, she is again a senior consultant, obstetric and gynecologist. She is a treasurer of the Chennai Menopause Society. Welcome, ma'am. Very honored to have you. We have Dr. Kosigan, senior orthopedic surgeon in Apollo Hospitals. So very, very happy to have you with us. And Dr. Tyagarajan, senior consultant in sports medicine, SRMC and Research Institute. It's a very unique combination of both orthopedic and obstetricians we have for today's session. So with these few words, I hand over the session to our moderator for today's session, Dr. Meera Raghavan. Please, ma'am, take over the dais. Thank you, ma'am.
Thank you. Happy Women's Day to everyone out there, and the people who really care about women, who care for women. And that is why you're all joining this webinar, which is going to home in on the wellness and well-being of women and their healthcare. Now, I'm just going to give you a brief outlook into how the webinar is going to be. We're going to concentrate on various issues about women's health, promotion of well-being of women, and the general healthcare aspects. And we have experts who can give you valuable tips based on that. We had done our homework by getting questions from the audience in prior, people who had registered, and we have grouped them into various groups for our experts to answer. I'll be going around the panel with each of the questions, and each panelist will be giving their valuable tip, which you can take home as an important message regarding women healthcare and in general, your well-being. So the first question to Dr. Kosigan. How common is knee pain and joint pain? Is there a difference between men and women? Dr. Kosigan?
Good evening. Happy Women's Day to all of you, and thanks for inviting to be part of this program. And now, knee pain is common both in women and men. Postmenopausal, there could be two different sources of pain. Not all knee pain is arthritic knee pain, and all knee pain is not actually a pain which will progress and cause major disabilities. And there's one common, not misunderstanding, common misconcept is one pain could be due to osteoporosis. The other cause of pain could be due to osteoarthritis. And in the younger population, there could be so many reasons for pain. It's not only the joint, it could be the tissues which are enveloping the joint, such as the ligament, cartilage, the muscles, and everything. In general, when I see patients in the outpatients, when we say you have two different problems, you seem to have osteoporosis, you seem to also have a little bit of osteoarthritis, they seem to think both are the same. So because the incidence or prevalence of osteoporosis is a little bit more common in women in postmenopausal, we feel the arthritis is more in women. No, that's not the case. The source of pain or the cause for pain is different between the two. So one pain could be because of the general skeletal pain because of osteoporosis, and a focal single joint pain could be because of osteoarthritis. So it is common in both. Osteoarthritis is not necessarily more in women, so you don't have to worry that, are we kind of at risk to more osteoarthritis? No. But the bone below the joint is also participating in taking your weight and sharing the in load sharing. So the bone below the joint is prone for osteoporosis or osteopenia. Hence, the bone pain or musculoskeletal pain in postmenopausal women may be more common in women than in men.
Okay, thank you. That was very elaborate and clear. So both osteoporosis and osteoarthritis can cause pain. Maybe we see women suffering more with the waddling gait and so on and so forth. Thank you, Dr. Kosigan. Next question to Dr. Tyagarajan, sir. What about, one question is, can arthritis be cured completely by exercise?
Thanks for having Happy Women's International Women's Day. And it's a very interesting question. Can arthritis be cured completely through exercise? Yes and no. Yes, because some type of arthritis are non-progressive, and especially when it occurs in young people, it can be cured with exercises. So, but majority of the arthritis are sometimes progressive. They cannot be cured just by exercises. They need to have other modalities like medications, braces, and sometimes special injections like hyaluron and PRP. And sometimes, as a last resort, we would probably require surgical procedures also. So it all depends on the age, the type of arthritis, whether it's rheumatoid or osteoarthritis or things like other types of arthritis. And whatever it is, with all modalities, exercise also has to be included in the management of any arthritis. Exercises could be stretching, strengthening, simple exercises to some focused exercises. So we need to be aware of that. And yes, majority of the arthritis would require something extra other than exercise. All arthritis, they require exercise also. I hope I answered the question.
Absolutely. Thank you very much. So exercise is for all, but exercise necessarily might not mean cure for all. You might need something extra. That's very clear.
True,
So
summarized
thank you.
well. Yeah. Welcome.
To Dr. Dhanalakshmi, what about calcium and vitamin D? Is it for every woman? Is it for every man? Is there a difference? When do we give it? You're muted.
Every human being needs calcium, and everybody needs vitamin D. When it comes to women, we need to strengthen the bone bank from 30 years onwards. Otherwise, we tend to lose this calcium much faster than men. The accelerated loss of calcium is more in women after menopause. So to prepare for that, if you can catch them young and continue the calcium which we start in pregnancy, I think to some extent it can elevate it. But I feel more the women who lose calcium in pregnancies, successive pregnancies, never build it back. and especially after prolonged lactation and all that, they fail to take those iron calcium after delivery. They stop it. Till delivery, they pamper themselves. After delivery, they stop it.
So very important message. Continue your calcium even after delivery, because that is the time you go on a negative balance. And very important concept Dr. Dhanalakshmi has emphasized, banking of your calcium is important. So make your calcium your FD and RD in case you don't want to suffer from bone loss as you age. Thank you very much. Dr. Shanti Gunasinghe, ma'am. The question for you is estrogen for every woman after menopause to maintain good health and bone health? Ma'am, muted again, please unmute.
Estrogen is the female hormone which is essential for every woman. So what happens in menopause is, estrogen starts declining. Afterwards, it nearly becomes very less. So although we understand that menopausal problems are due to estrogen deficiency, estrogen supplementation for all is not necessary at all. In indicated patients, especially patients who are symptomatic, who have certain problems like hot flashes, where suddenly even in an AC room, they will sweat like anything and they will feel very hot. So in such symptoms, or when they have some urogenital problems, that is recurrent urinary tract infection or difficulty in coitus, or if the menopause occurs too early, as in premature ovarian insufficiency, or probably when there is surgical menopause, suddenly at a younger age, uterus is removed, and probably to a certain extent, even sometimes ovaries are removed. In that extent, in those conditions, probably estrogen is needed. But otherwise, it is not for everybody.
Thank you, ma'am. Again, that was a very clear message. Yes, estrogen is essential, but not everyone needs to have an estrogen supplement after menopause, because that is only in certain clinical indications, as madam has elaborated very clearly. Hope that message is also clear. Next question to Dr. Kosigan. What about low back ache? Why is it caused? Is it very specific in certain age groups? And is it specific in women? Dr. Kosigan, you'll have to unmute yourself.
Yeah. Says I'm unmuted. Is it not?
Yeah, it is now.
Yeah, okay. See, the vast majority of back pain, fortunately, or benign back pain, by which I mean it is either posture related or any unaccustomed activity for a brief period. A lot of people take to newer form of exercise, which is good, but sometimes not knowing what the exercise are. Now, and the vast majority also gets better with physical therapy and a brief period of maybe assistance with medications. Now, in terms of disc prolapse and sciatica, generally we tell even our junior residents, it is uncommon in the elderly people. In the elderly people, if it is a back pain, a sudden onset of back pain, they do need to be aware of whether this is not a disc, but is probably a osteoporotic wedge compression fracture of the spine, or if the person also has some rest pain, those kind of back pain in elderly person needs to be investigated earlier. In the younger group, of course, it's most commonly disc or muscle spasm or post-traumatic injury, where you can initiate a treatment, see the response to the treatment, and then wait to investigate further. But the same thing in post 60 or 65, particularly there's a pain without a recognized injury and a gradually building up pain which is increased, and there is rest pain. They do need to be investigated for one of the common things in women, of course, is osteoporotic wedge fracture, which can happen even without significant injury, even a violent cough or bending down to lift something, and the other causes which can affect the spine. So yes, the cause for the pain in someone who's under 40 and the cause for pain someone who's over 60 is different in terms of back pain. If you do have pain even at rest, that needs to be investigated earlier, or earlier consultation is advised. But a vast majority of the pain in the younger group is manageable with physical therapy and medication, and not all back pain or sinister. But above age of 60 and 65, one should not put it down as sciatica and without any further investigation. They need to have a consultation earlier, and certain investigation has to be dealt with earlier.
Thank you. Again, a very lucid message. Pain in the elderly, especially above 65, is not just pain in the back. It means something serious, so needs immediate attention, evaluation, and imaging. Thank you for that. Dr. Tyagarajan, next question. How important is muscle strengthening in comparison to bone strength, especially for females? Dr. Tyagarajan, we'll have to unmute.
Yeah, I've done that. It's
Thank
again a very important question. Muscle strengthening in bone and other pains. As we age, the muscle mass gets less and less. It has to be maintained at the same mass level by way of physical activity and exercises. So if the muscle mass is less, it leads to weakness, and it might affect the biomechanics of the body movements, making people prone to various kinds of pains. And also, it can lead to falls in elderly. So that is why an optimal muscle strength is essential for all ages, especially when it comes to the elderly people, especially when it comes to elderly females, because they are more prone to muscle wasting and the resultant ill effects of orthopedic pain and fractures resulting from falls. So all don't need to go to the gymnasiums or other forms of fancy exercises. Muscle strengthening can be done by simple household activities and simple physical activities like stair climbing or walking, or even doing some practices like yoga and other things. So in short, muscle strengthening is very important as we age. As elderly ladies, it's very important to prevent the falls, fractures, and also to keep their joints at an optimum level of functioning. That's it for me.
Thank you. Thank you. Next question to Dr. Dhanalakshmi. Is PCOS all about childbirth, or is it more to it? And again, unmute.
Yeah. PCOS is something, once it forms, it stays with you. It is how you harness it decides what you're going to suffer from. Okay, so it can start around 9 to 12 years of age, when binge eating is entertained in the children. Okay, when they take to more of screen time and less of sports or less of sports activities. So these are the things that cause a mild obesity, which is cute to look at initially. Then it becomes bothersome for both the child and for the parents. Then this goes on, and during a marriageable age, so this goes on and it produces a lot of she might get irregular cycles even beyond the expected time. Like we expect the cycles to be irregular after the girl attains the first period or the menarche. After some time, she should get regular cycles, but this might continue into more than say 5-7 years after the menarche has happened. And not only that, her skin quality might also acne and extra unwanted growth of hair. This also might be there, and um, she might get kind of adverse remarks by her classmates for being a little on the chubbier side. So, and she may not be able to do what she wanted to do at that age. And then this, if it is not identified at that age, not corrected by appropriate lab investigations, because we cannot rely on if basically something for all this would be only a lifestyle modification, I would say. Then it goes on into the reproductive age group where it might affect her fertility. And then again, somehow she conceives and then she goes into 35, 40s. The same PCOS will continue as a regular cycle. So this PCOS never goes off from a system. It is the way we keep it in check is important, and that is only by lifestyle modification. That's why I write first treatment exercise, second treatment exercise, third treatment exercise, fourth treatment diet, fifth treatment diet, sixth treatment diet. You do all this for 6 months and you come back to me. And we do a basic test just to satisfy the patient, but test is not going to help us anywhere. And weight reduction of at least 5 to 10% from the current weight is what is initially expected. Once the patient understands or feels the difference between the previous weight and the current weight, she'll get into it automatically. So PCOS is a recent onset menace. I would say it's an epidemic. It has come to epidemic proportions, I would say. Maybe there are so many other factors that have contributed to it. One of them is double income and availability and accessibility.
Okay. That is a very powerful and candid message to everyone out there. PCOS is not just about childbearing, it's an underlying metabolic illness. And unless we do something about it by changing things for life, not just for 3 months, not just for Diwali or wedding, it persists. So the more you resist, it's going to persist. So make a change for life. You will be able to reverse PCOS. Thank you for that clear message, ma'am. Thank you. Next interesting question to Dr. T.K. Shanti. Life after 45. Is it irritating or something to look forward?
What, Meera? Life
after 45.
Is
it irritating
Yeah.
or something to look forward to in context of menopause?
Yeah, it is something what we should be looking forward to, because it is just a stage in life, like childhood, then you become a girl, then you become an adult. So just like that, it is but a phase in life. And of course, there are a lot of, although people are a bit apprehensive about the word menopause, but then it brings with it in its wake lot of good things too. See, they need not think about their periods when they want to travel or when they want to go to temple. They can plan anything and everything. So many things are there. And of course, as we age, our wisdom also helps a great deal. So I think it is one stage which we should look forward to, and it can be managed really well, provided we accept it. And if there are any problems, then that can be addressed too by seeking help, and we can really enjoy midlife, and after it can be pretty colorful.
Thank you. That's very encouraging for many people out there. Just probably have to embrace with grace. Thank you. Next question to Dr. Kosigan. Can you throw some light on bone health after menopause?
Yeah, I think it's an important part of this discussion. Bone health after menopause. Now, the difficulty is the early menopause. Now, some of them are surgical early menopause and some of them are naturally early menopause. And we see patients sometimes around their 50s or 55 plus, but the menopause is already around 42. So one thing is to not to assume the menopause is always going to be 50 plus. The number of years after menopause is going to be quite important. And it was interesting, Dr. Dhanalakshmi say about the peak bone mass one is supposed to reach around 30, 35. That's very, very essential. That is the fixed deposit and the recurrent deposit, as Dr. Meera said. Yes, the physical activity in your teenage and your adolescence and before 30 or 35 is quite important to achieve this peak bone mass to a high level. Because if it's not, and then you also have an early menopause around 42 or 45, you are certainly a very high, high risk candidate for osteoporosis and thereby the complications or the musculoskeletal symptoms related to osteoporosis. So bone health post menopause, certainly there is certainly less of an acceptance or insistence on the HRTs here compared to other place because of the small risk of the cancers. And also there is a tendency to think 60 is, it's almost an age where everything is finished and no interest in life. Now, I think those two things have to change. People have to enjoy and continue to be physically active and maintain a good degree of physical activity. And if they don't have diabetes or any other issues, have a good mixed healthy diet and not be shy of taking vitamin D and calcium supplements if they are particularly an early menopause group, either surgically or naturally. But that is important because when we see patients in the clinic, they are not on any supplements sometimes for the fear that calcium can cause cardiovascular problems. It is not always the case. Unless your cardiologist is told not to take it because your cardiovascular problem is due to calcification, I think they do need to think of some supplements of vitamin D and calcium 2 years post-menopause, and at least a bone density measurement 5 years post-menopause to rule out osteoporosis, and maintain a good degree of physical activities. Those who also have other joint-related problems along with postmenopausal, even more emphasis on taking some supplements to minimize the risk of developing osteoporosis. So I think the fixed FD and Dr. Dhanalakshmi's mention about peak bone mass makes a big relevance here. If you've not been an active child or active adolescent, it's unlikely that you have good peak bone mass. On top of that, if you do have an early menopause, then you have a high risk of getting osteoporosis. So maintain a good degree of physical activity and don't be shy away from supplements of vitamin D and calcium, particularly if you're early menopause. Don't shy away from that. If your cardiologist says stop it, that's fine. But otherwise, don't be shy of taking those supplements and maintain a good degree of physical activity. Even if DEXA scan shows you're an osteoporosis, don't worry. There are excellent medications, very good medications, which can help you to maintain a good bone health. Thank you.
Lovely to know from the horse's mouth. Yes, calcium and vitamin D essential, at least for 2 years post-menopausal, and catch them young. Very candid message to all the teenagers, adolescents. No more sitting on their gadgets. Get out and play. Have physical activity if you are going to increase your bone bank. Thank you very much. And most important message, BMD for all menopausal women beyond 5 years of menopause, just to know how it's going on and how to strengthen it further. Thank you. Next question to Dr. Tyagarajan, $1 million question. How to maintain weight as we age?
As you mentioned, it's a question among the millions and millions of people. Weight gain, again, is due to multiple factors, right? From genetic to your nutritional, to your related to physical activity, cultural, and so many other things. But even if you have a risk of weight gain by your genetics and other things, metabolic disease, everything. But if you do a careful dieting and bare minimum of physical activity and exercises, your weight is going to be favorably coming to the normal side. So having a balanced and healthy diet and having a regular physical activity are two major cornerstones here, based on which the weight issue can be balanced. Of course, you might have to evaluate metabolic and other causes of endocrine causes of weight gain and have to rule out, and sometimes we might require treatment for that. But in majority, physical inactivity and as our earlier panelist mentioned, excess of everything, double income, too much of everything is going to be the cause of it. So message is at least walk 20 minutes a day, do a brisk walk, and watch what you are eating. Just with these two things, a lot of weight gain problems can be addressed. So that is going to be our message.
Thank you. So that answers that question. So stay healthy, balanced diet, and keep moving if you want to keep a check on the weight. Thank you. Next question to Dr. Dhanalakshmi. Can you ever overcome PCOS? And how do we overcome PCOS?
As I told you earlier, it's a disease. Once it sets in, it stays, but you can harness it. So the only way to overcome PCOS related issues is only by keeping the weight in check, and that can be done only by appropriate diet. I think we can go back to our good old method of balanced diet, which had everything: carbohydrates, proteins, and fats in moderation, and sweets only for festivals, and goodies only for certain occasions. So that with the indulgence, I would say indulging is what makes this PCOS features exaggerated, and that stays with us. It's now it is linked to genetics. We can't do much about it, but we can harness it. We can keep it in check.
Thank you.
So it's again the same thing: lifestyle modification and follow a healthy diet and healthy exercise habits.
So that's a very important clinical point, that though it can be genetically determined, we modify the lifestyle factors and work on the epigenetics, which can then modify the expression of the severity of the problem. Thank you for that. Next question to Dr. T.K. Shantiguna Singh. Now that you've told life after 45 can be quite colorful, what is your general guidance for all the menopausal women in terms of maintaining health, both holistically and in particular gynae related health?
Yeah. So, we first thing is, as I said earlier, also acceptance of the changes which are happening in your body. We have to accept that, and then it is very important that with menopause comes with its week a host of diseases too, especially metabolic diseases. As the Indians, we are prone for diabetes, hypertension, dyslipidemia, and of course with menopause, certain cancers also can come along because we are aging. So we have to be really proactively do certain preventive measures for all that. So since cervical cancer is the commonest, second commonest cancer in our Indian women, routinely we ask our people in menopausal age to come for regular pap smear, regular mammogram, so that they are at peace. And then, of course, a healthy lifestyle, mindful in everything, mindful eating, mindful exercise, and try to be stress-free. See, now this period can be the children would have gone out, so emptiness syndrome. So you have to think that how to utilize this period happily and usefully. So all that acceptance and being stress-free would really go a long way. And we think vaccination is for youngsters. But then as we age, we are prone for certain infections too, like pneumococcal infections, all these things, flu. So if we take vaccines against that also, we can have a very pleasant postmenopausal life.
Thank you. So the message again clear to everyone. You just don't take your children to the clinic for vaccination. Take your grandparents also for vaccination, especially for pneumococcal and your flu vaccine or flu jab every year, so they don't develop any kind of pneumonia. Very important, especially 50 plus, and more so if they are diabetic or suffering from asthma. Thank you, ma'am, for that wonderful message. Next question to Dr. Kosigan. Can PRP really cure knee joint pain, or it could be a alternative to surgery?
Like any disease or pathology, it depends on the grade of the disease. Certainly the use of PRP, and in fact, the more richer source of platelets or the growth factors, which is a bone marrow aspect concentrate, is, there is more growing demand for that. And there's also published results saying it does help to slow down the degeneration. Now, with regards to using it in orthopedic practice, I and the orthopedic community in general has had a good outcome with regards to soft tissue problems like tendinitis, partial tears, partial ligament injuries. We've had a really good outcome using PRP, either from peripheral venous blood or from the bone marrow. Now, with regards to arthritis, I tell there's broadly two groups where the joint is arthritic, but the alignment is maintained. In those groups, you can expect some regeneration following injection, intra-articular injection of PRP or bone marrow derived products. But if the joint itself is malaligned, the load-bearing mechanics are also malaligned, the outcome may not be the same as in patients whose joints is aligned. So yes, there is a role for PRP, either from peripheral venous blood or from bone marrow, in terms of regeneration or slowing down the degeneration and thereby pain relief and improvement in function. But with regards to soft tissues around the joints, we've had some really good results, even with full thickness cuff tear around the shoulders. And a vast majority of the ligament injuries were not keen for surgery or were not that high demand for people who can accept injection and a period of immobilization and plaster. We've had some good results. Certainly a growing aspect of orthopedic interventions. And we are seeing some publications also coming over the last, the 3-year outcome and 5-year outcome, which is encouraging that it is not certainly a placebo, but it does have some regeneration potential. And I must say, we have taken some approval for treating certain quadriplegic and paraplegic with this intervention, and they are regaining certain movements. So there is some science to it, I think. But if the joint is malaligned, I don't think you can expect the same results. Joint is well aligned or aligned, and the joint is arthritic, yes, I think viscous supplementation and PRP certainly is helping to reduce the pain as well as reduce the degeneration.
So excellent. Again, we can buy time if your joint is aligned to postpone surgery and be pain-free and stiffness-free. Thank you. Dr. Tyagarajan, what is the cure for fibromyalgia associated with menopause? Body stiffness, muscle ache, joint pains, bone pains, all related to menopause. What can we do about it?
Yeah, again, a very common condition. About fibromyalgia itself, we know that it's a diagnosis of exclusion. We cannot diagnose it clinically or through, say, investigations. So we exclude all other conditions for this common kai, kal, mudugu, vali, general pain, and then come to a conclusion that it could be a fibromyalgia. Though there are certain clinical features peculiar to fibromyalgia, like tender spots, and then there are trigger spots in the muscles. Again, fibromyalgia has multiple causes, including, say, uh, lack of proper sleep or improper posture or stress coupled with vitamin deficiencies and improper movement patterns, improper ergonomics, sitting, lying ergonomics. And so we have the treatment or the cure has to be aimed at all these things. We cannot simply treat it by medications or physiotherapy, but we have to address all the causes. Importantly, stress management and things like yoga, meditation, relaxation techniques, and sometimes a little bit of support from the medications and physical therapy helps. So the cause is multiple. So our management also has to be in a multi-pronged way. A thorough counseling of the patient regarding the explanation of the condition that it is not a disease, it's not a dangerous condition, and explaining how we can prevent it or manage it goes a long way of in helping these cases because medications sometimes they do not help. So that is the message. Fibromyalgia is difficult to diagnose. It's a diagnosis of exclusion. Thorough counseling is required for the patient, for them to understand, and they have to deal it with the multiple methods, including physical therapy, medications, and various lifestyle physical activity modifications, relaxation, yoga, etc. Thank you.
Thank you. Thank you. To Dr. Dhanalakshmi, thyroid issues in women. How common are they? Why so? And what do we do about it? Ma'am, unmute, please.
Thyroid issues can be identified in any woman. Actually, we suspect in any age group whenever there is a menstrual irregularity. So the first thing, even some of the common women also ask us to write a prescription or request for thyroid function test. They are aware thyroid function can derange the menstrual cycle. So and this thyroid deficiency uh, also can cause certain problems in the unborn child. So thyroid supplementation during pregnancy is very, very important again. If the TSH is found to be very high, even though in between there was a controversy whether 2.53 and 3 should be kept as a cutoff for 3 trimesters. Nowadays, we do consult endocrinologists for supplementing thyroid. Levothyroxine for pregnant mothers. And thyroid deficiency usually manifests as tiredness, which they come with a lot of tiredness and their hemoglobin looks perfectly normal. They are otherwise not looking anemic. Look out for thyroid. A little bit of supplements of thyroid for a marginal raised TSH is all that is needed for most of the problems. And many of the menstrual irregularities, I have seen a young girl coming with a huge ovarian cyst. Okay, it just disappeared with 3 months of thyroid supplements because the TSH was around 35 or 40. So she developed a huge ovarian cyst. So because they share a common amino acids with the HCG, so the girl has developed and she came actually with pain abdomen. Then as a part of routine investigations, we found that the TSH is high. So TSH I mean, the thyroid issues can be there right from beginning till menopause. I don't want to touch menopause. Madam should be talking about menopause now. And but of course, this we have started doing thyroid estimation with the T40SH thyroid function test routinely in pregnant mothers. Unlike the earlier days where we used to do only in indicated cases, now we have started doing it as a routine.
Thank you, ma'am. Next question to Shanti, ma'am. Are there any natural sources for combating symptoms of menopause? We now heard from Dr. Kosigan, are women kind of reluctant to take any HRT because of the risk of breast cancer and things, and not estrogen is not required for everyone out there. But there are people who complain of symptoms of mood swings, sleeplessness, or kind of hot flushes. Not so much in India, but they do. So what do we advise as natural methods for combating these symptoms, which can be quite unpleasant?
Yeah. If they take a well-balanced diet itself, that will really go a long way. And we have certain substances called as phytoestrogens. That means estrogens from plants. Okay. So all these things like soya. So all these things also have some beneficial effects. And as our orthopedician said, people are sometimes wary of taking calcium. So if they take a good calcium-rich diet in the form of ragi or low-fat milk, curds, so all these things themselves can give a good supplementation. And omega-3 fatty acids also is very, very important. And that can be got from nuts, chia seeds, and of course for non-vegetarians from fish. So all these things are good natural sources of which can combat menopausal symptoms.
Thank you. Very clear message about use of phytoestrogens, non-dairy sources of calcium, and omega-3 fatty acids available in your nuts and seeds for lubricating your joints. Fantastic, madam. Thank you. Next question to Dr. Kosigan. Are collagen supplements needed for menopausal women? Are glucosamine supplements needed for menopausal women? We get children coming from the America to find out whether their parents need those boxes of collagen and glucosamine. Are we supposed to dish them out?
No, collagen. Anyway, first of all, chondroitin and glucosamine on its own has not shown to have much benefit in terms of stalling the progression of osteoarthritis or improving the symptoms from OA. It has been long used. Certainly, the collagen base in combination with chondroitin and glucosamine as well as curcumin for pain relief is becoming very popular. Now, quite at least a significant amount of postmenopausal women may not have osteoarthritis in their joint. So I don't think routine collagen or these joint replacement supplements is required. But when these well-preserved women with well-preserved joints do get any early osteoarthritic symptoms, no other cause for their joint pain has been identified, then I think it's worthwhile, along with vitamin D, calcium, to cover up, along with that, to start on these joint replacement, these nutraceuticals I think is worth considering, but not as a blanket for all postmenopausal women, because there is a growing awareness of the need for physical activity among this group, and some of these people are actually well preserved these days. And if the joint is okay and there is no joint related symptoms, there's no need for routine prescription of these collagen based supplements. And chondroitin and glucosamine in isolation, I don't think is of much use.
Thank you. So too much nutraceuticals is a waste of time. So only if there are joint issues, we will need them, not as a blanket prevention for every menopausal women out there. Thank you. Dr. Tyagarajan, your question. Are thin people always fit? Are fat people always not so fit? What is your take on visceral fat?
Aha. I think you have reserved the toughest questions for me. Anyway, thank you. So we'll come to what is thin and what is fat. So we know that genetically people they come in different sizes and shapes. So based on the anthropometric characterization, we have basically at least three types of bodies: people who are lean and tall, people who are medium, and people who are a little bit curved and rounded, to say it simply.
That's kind.
And yeah, yes. And also there is a thing called the frame size, the body frame size. And then there is this body mass index, the body fat percentage. So depending on this, medically, we decide a particular person is fat or thin or lean. So the second question is, do essentially fat people are unfit and thin people are fit? Yes and no again, because thinness or the leanness probably explains their good dieting practices and physical activity practices, and probably they are less prone to get this non-communicable diseases, whereas the heftier ones are the other way, but not necessarily. So we have seen extremely fit people who are fat also. We have many athletes. If you see a lot of athletes who are throwing big these things, and also sumo wrestlers, they probably are uh, healthy as well because their body types are just different. So, but in general, an excess amount of body fat is not good for various reasons we all very well know. And uh, thin people, if they are healthy, they are definitely fit, but they can be thin due to sometimes diseases also, like malabsorption syndrome and all things like that. They don't just put on weight or some hormonal imbalances. So we cannot definitely use a blanket statement called thin people are fit and fat people are unfit, but really have to dwell deep into it. And ideally, a balanced weight is required. That is why we have simple measures called body mass index and more sophisticated measures like DEXA, which can give you the exact percentage of body mass and bone protein and bone muscle and the fat mass. But there are simple ways to measure that also. So answer to the question is, yeah, it's not always true, and it could be the other way around also. Fat people can be fit and thin people can be unfit due to some underlying disease also.
Okay.
Thank you.
Thank you. And again, an excellent message. Never judge the book by the cover. So you do not necessarily mean that thin people are metabolically healthy and fit. So we need to assess what exactly is down there. And because the reason why I asked this question is when we advise people with PCOS to exercise, the mother immediately jumps and says, "Ava already uliyadarka." So, that kind of resistance is there, so which is why we wanted to send this message out. Thank you for that. Next
Excellent. Thank you.
question. Next question to Dr. Dhanalakshmi. How about mental health in women when they actually face certain diagnoses which we put forward to them? Say, for example, PCOS, chocolate cyst, or even an early cancer or a pap smear abnormality. How bad is it? How do we deal with it?
Breaking up bad news. We learn it over a period of time, and they need. I take a pen and a paper and explain to them, and we have to spend that extra 2 minutes to 5 minutes depending on the condition you're dealing with. If it is a uh, abscess abnormality, you don't have to make them feel guilty, like because of why it was caused. We not have to talk about it. You can tell them like how it can be further evaluated, how it can be treated uh, before it becomes. Suppose it is the early invasive stage. I mean, pre-invasive stage. How it can be prevented. And you can take this opportunity to uh, emphasize that vaccination is available for the younger lots these days. And if it is something like a PCOS, yeah, PCOS these days it's also shocking news for most of the parents, and they feel like their life is doomed. குழந்தை பாக்கி இருக்காதா? The first thing that they are worried is they are aware like PCOS can hamper the infertility. So this kind of a the child is having some kind of a metabolic issues which can be harnessed, should be put across very gently. And the actual cancer, needs a lot of when there is a diagnosis of a cancer made in a woman, you need to rehearse before calling the patient inside. And I we have to involve the stakeholders also, and explain to them in detail uh, how the disease, what is the stage of the disease, and what is the treatment available. How sticking to a program designed by you and by a radiation oncologist or a medical oncologist can cure the disease to some extent or sometimes completely. So breaking a bad news is not that I was very good at in the beginning of my career. Over a period of time, we all learn. So empathy. We'll have to listen to them. First listen to the entire story, and then we can give 2-3 lines at the end of their listening.
So a very powerful message, most important listening skills and an empathetic approach rather than giving out all the information. They might not be in a situation to grasp everything we want to tell them. Thank you, ma'am. Next question to Dr. Shanti. What is perimenopausal stress and how to deal with the mood swings which can happen around that time?
Yeah. So, menopause generally in Indian women occurs around 46 years. So, certain changes occur prior to menopause, 3 to 5 years prior to that, and about 1 to 2 years after menopause. So, those changes can be physiological changes which can be problematic sometimes. And this is called as menopausal transition. In this, people are prone for lot of mental issues too. So this can be your physical changes can be quite stressful. On top of that, because of the declining estrogen levels, you can have some stress-related problems too, which can be addressed provided, the woman is ready to face it and then come out of it. But once they accept it, they come out of it. Generally, all these changes do not result. It's more around transition that we see such changes. So being mentally prepared, a well-armed is the condition. If help is can be.
Thank you, ma'am. Dhanalakshmi, ma'am, can you mute? Thank you, everybody. I think we have clearly spent a good hour answering all the questions which we had grouped individually for different speakers. It is now time to take the questions which have appeared on the question and answer box, the chat box, the YouTube live, the FB live. So the first question, is it true that after menopause, women tend to get heart problems?
So what happens is estrogen is protected, because of estrogen, women are protected against heart disease initially. So menopause removes that armor. So after that, women are also prone for heart disease like males. So it is really true to a certain extent that after menopause, women are prone for heart disease.
Thank you. And what is the advice on irregular periods, Dr. Dhanalakshmi? And what could be, oh, madam is logged off. Okay. Irregular periods basically are related to abnormal hormone balance. So, maintaining a healthy lifestyle, appropriate physical activity, good amount of quality sleep, and balanced diet are essential, and stress management on top of that, so that periods don't remain irregular. The other question is about knowing what are the menopausal symptoms. When should somebody think they are going round the change?
Menopausal symptoms can be one thing. See, they can sweat a lot. Okay, I already talked about hot flashes. So even in a AC room, they can just break into sweats, and this can be more marked at night. They can become very apprehensive. They can have insomnia. They might not be able to get good sleep as they had done earlier. So all these things, and they can be a bit irritable. So all these things are probably symptoms of menopause. And after some time, it has its effect on the genitalia. So they can have difficulty in having performing sexual act, or recurrent urinary tract infection, or bone health might be affected. So all these things can occur a bit late.
Thank you, ma'am. One person is also asked and is thanked for arranging such a informative session to know the right balanced diet. The message to Ms. Lavina is there is something called myplate.org. It's a picturized way of telling you a visual clue of what color foods you should be eating on which portion of the plate. A standard 9-inch plate, and populate the plate with color as given in that. Basically, make your plate look like a rainbow. You're eating a healthy, balanced diet. So make sure you include protein in every single meal. You cut down on the simple sugars, and minimum dairy as to 1 or 2 glasses max a day. So if we follow that with adequate hydration, that is balanced nutrition. I generally tend to avoid the word diet because diet is very restrictive and gives it a feel that you're going to continue it only for a certain time and it's not for life. So a balanced nutrition would be a better way to approach the whole thing. So it's myplate.org, and remember, color your plate like a rainbow. Thank you. I think we're pretty much keeping on time to the end of the session. While we are there, I would like each of our panelist speakers to give out 3 strong take-home messages on this wonderful International Women's Day. So starting with Dr. Kosigan, 3 important take-home message for our women and the carers out there.
Yeah, first is life after 45. I think, yes, that's certainly something to look forward to. Certainly to all the doctors here, I think your life starts after 45 or 50 to enjoy your life. So hope the doctors don't forget to maintain their bone health. Not all bone-related problems are sinister, so don't worry. Bone pain and joint pain is different, and both has got solution if you seek help early. And maintain a good degree of physical activity as much as your physical ability allows you to. And don't retire at 60. You need to keep going on, because the life expectancy, even in our subcontinent, has increased compared to what it was 20 years ago. So beware that bone or muscle-related problems can occur. So to all the youngsters out there, like again, Dr. Meera said, you don't have to necessarily throw away your mobile phones and iPads, but maintain a good degree of outdoor physical activity. You don't have to hit the gym always. Now, some of the patients, I say, you may not be able to go to the gym, but if you have to go to a certain distance every day, like 5 kilometers, maybe you can think of going part of the way by walking, like 2 kilometers, 2.5, and take a public transport or any other form of transport. In that way, you don't have to schedule a separate time to do that 5 kilometer or 3 kilometer walking every day. And don't shy away from taking the vitamin D or calcium supplements if a doctor is advising you with regards to your bone health. Once again, stay healthy and enjoy. Post Spotify is not difficult. I see a good number of people above even 80 who are physically active. And in terms of who copes better post,
You've gone on mute.
than the men.
the women definitely cope well beyond their 65 better than the men. So happy Women's Day to all of you, and thanks for this wonderful opportunity.
Thank you for that encouraging, reassuring message on this day. Next to Dr. Tyagarajan.
Yeah, again,
What shall we
thanks
take
for
home?
having me in here.
Thank you, sir.
Are you able to hear me? I'm
Yeah.
unmuted, right?
Yeah.
Okay, thank you. So 1, 2, 3, you have asked 3 messages. Maybe I can say that eat well, sleep well, and live well. So these 2 things make you live well. Happy Women's Day. As everyone has told, you have to be physically active and watch your plate. That solves most of your miseries. And to add to that, we know that this 60 is the new 40 and 40 is the new 20. So that should be encouraging. And also sitting is the new smoking. So these are all punch dialogues. So deliver a punchy message. Sitting is the new smoking. Avoid sitting for prolonged time. Okay, I'm signing off. Thank you very much. Happy Women's Day.
Thank you. That's wonderful. Thank you. Shantiba, 3 important take home.
Okay. So as I said earlier, you accept menopause as a phase of life, which all of us have to undergo. And looking forward to it itself brings about reconciliation with any pathological changes if they occurred. And you can really be mindful in your behavior. As you said, nutrition, exercise, and all these things are lifelong affairs. So that is very, very important. If we are so, that itself will mitigate a lot of problems. And as prevention is always better than cure. So preventive gynecology in the form of having pap smears, mammograms, vaccines will go a long way in prevention of non-communicable diseases as well as cancers.
Thank you. Again, a very practical and powerful message. And my 2 cents worth of take-home messages: your health is your responsibility. And make your doctor your friend. Pay them a friendly visit every year for regular checkups. And if you make lifestyle changes, you live your life in style. Those are my messages for you to take home at the end of the session. I thank each and every one of our panelists who have contributed their time, their energy, and their efforts to participate so enthusiastically and powerfully in giving out these pragmatic, clear messages to public out there on this very International Women's Day and inspiring all of us by being inclusive. And I sincerely thank Avana Surgicals for being our partner, both in streamlining this whole program on this day, for creating such a wonderful session, which has been more interactive and informative.
Thank you, doctors. That was wonderful. I think take-home messages has been very, very clear. Once again, thanks a lot for all the experts on the panel and moderator, Dr. Meera, along with Dr. Shanti, Dr. Dhanlakshmi, Dr. Kosigan, and Dr. Tyagarajan, sir. A heartfelt thanks from entire team from Avana, and thanks to each and every participant. I would like to close with the theme of the year. I did not do it purposefully. I thought all the take-home messages come so that we can do the theme of the year. The theme says very clear, ma'am. Invest in women, accelerate progress. What more we can ask for with all this knowledge, what you have shared with you? Even though whatever people have joined today in the Facebook Live, also in the live webinar through these links, they're going to be investing in themselves And together as a society, we are going to invest in women and we are going to accelerate progress. Madam. So what more we can ask for? Thanks a lot once again for this wonderful time you had spent with us. And thanks to all the participants and thanks to all the support, the back team, Rohan, for arranging this platform in an excellent way. So we could all connect in a very smooth manner. Thanks a lot and a happy weekend and wonderful time ahead for all of us, ma'am. We will
Can
be
we
shortly.
request all to switch on the video so we can have a gallery pic? That'll be great.
Sure, ma'am. Sure. Rohan, if you can, yeah.
Yeah, Rohan can take a pic. Thank you.
Thank you. Thanks a lot.
Thank you.
Good night.
Thank you, ma'am. Thanks a lot once again, ma'am.
Thanks. Thank you.